Acute phase reactants, APRs, are a group of proteins whose plasma concentrations increase positive acute phase reactants or decrease negative acute phase reactants in response to inflammation. They are part of the body's early phase response to injury, infection, or other inflammatory stimuli. Key positive acute phase reactants. 1. C-reactive protein, CRP. CRP is produced by the liver in response to interleukin 6, IL-6, and other cytokines. It is a widely used marker for inflammation and can increase rapidly and significantly in response to infection, trauma, or chronic inflammatory diseases. It is often used in rheumatology to monitor disease activity in conditions like rheumatoid arthritis, RA, and systemic lupus erythematosus, SLE. 2. Erythrocyte sedimentation rate, ESR. ESR is an indirect measure of the acute phase response, reflecting the rate at which erythrocytes settle in a period of 1 hour. While it is less specific than CRP, it is often elevated in chronic inflammatory conditions and can be used alongside other markers to assess disease activity. Serum amyloid A, SAA is another liver-produced protein that increases significantly during the acute phase response. It plays a role in the transport of cholesterol to the liver and the recruitment of immune cells to inflammatory sites. SAA levels can be particularly elevated in acute infections and may also be useful in assessing disease activity in rheumatic diseases. 4. Fibrinogen. Fibrinogen is involved in clot formation and is also produced by the liver during the acute phase response. Elevated fibrinogen levels are associated with an increased risk of thrombotic events, which can be a concern in rheumatic diseases. 5. Haptoglobin. Haptoglobin binds free hemoglobin released during hemolysis, preventing oxidative damage. It is another liver-produced acute phase reactant and can be elevated in conditions like hemolytic anemia and inflammation. 6. Ferritin. Ferritin stores iron and releases it in a controlled fashion. In inflammation, ferritin levels can increase significantly, which can sometimes complicate the interpretation of iron status in patients with chronic diseases. Negative acute phase reactants. Albumin. Levels of albumin typically decrease during inflammation due to a combination of reduced synthesis and increased catabolism. Transferrin. Transferrin levels can decrease during the acute phase response as the body's iron metabolism is altered during inflammation. Clinical implications in rheumatology. Diagnosis and monitoring. APRs are essential in diagnosing and monitoring inflammatory and autoimmune diseases. For example, CRP and ESR are commonly used in the diagnosis and management of RA, polymyalgia rheumatica, and other conditions. Differentiating inflammatory conditions. The pattern of APRs can help differentiate between various causes of inflammation. For instance, significantly elevated CRP with mild elevation of ESR might suggest bacterial infection, whereas both being moderately elevated might indicate a chronic inflammatory disease. Guiding treatment. Changes in APR levels can guide treatment decisions, particularly in tapering or adjusting immunosuppressive